Hello, welcome to everybody. This is one of our series of GP webinars. We're in the series that's on specifically around personalised care and cancer at the moment, and this webinar is around health and wellbeing support for and information for people with cancer. Just to explain, we've got a contributing panel. However, two of our speakers have provided their presentations but aren't able to be here with us. So today on the call we've got Gabe Palmer, who's our social prescriber link worker from Southwark, the Southwark team, Nicola Weaver, who is our Southwark Macmillan GP, and myself, the programme manager for Personalised Care, Sam Tordesillas. So just what we're going to cover today, what we want to talk about is really thinking about health and wellbeing support to our patients with cancer in the wider context of personalised care. We really truly believe that a patient comes to us with a cancer diagnosis, but obviously that's not the whole part of their story, and so we want to look at cancer within the wider their wider needs. We want to explore the role of social prescribing, and Gay's going to share some of her insights as to the work that she's been doing, particularly with cancer patients. And we're going to hear a presentation from Dave Barnard, who's our Macmillan Right by You social prescribing project lead. And then, you know, there is a time and place for directing people to cancer health and wellbeing specific services. So I just want to walk you through some of the resources that we do have so that you can easily signpost to patients. And finally, just mention a way that we really monitor how we're meeting the health and wellbeing needs of patients by talking about the new National Cancer Quality of Life survey just at the end. So just to start, this is actually Simon Cross, is our personal health budgets and personalisation lead for South East London. He's unable to be with us today, but really this is I asked him to just set the scene for us and to talk about what's happening in personalised care in South East London in general. So just a bit of background about personalised care. It is definitely front and centre of the NHS long-term plan. I think we would say, in our experience, it's sometimes been viewed as the nice bit to do, the bit of the touchy-feely bit at the end, but actually having it in the long-term plan has really put it front and centre of how we're going to change healthcare delivery to meet our growing population's needs. And the big underpinning the principle in this is to stop asking for us to stop asking patients what's the matter with you, and really change that question to what matters to you, because I think we get a very different answer, and it looks at their healthcare needs in the context of all their other needs. So again, taking that very much more of a holistic way, working in partnership with people outside of health to be able to meet the needs of our population. This is just a little infographic that talks about those 6 elements of personalised care, and really with the patient right in the middle of that. And we have to be mindful that we're not just concentrating on one aspect of these elements, that all of these elements need to be considered when we're trying to meet a patient's needs. This is a really hard slide to read, but Simon was really keen to include it for you to take away and have a look at. But if we look at the column on the left-hand side, really these are the 4 big aspects that Simon's programme is working on. The first one being around the supported self-management, and looking at really trying to map out what we've got for patients in South East London, and look at where the gaps are in terms of support. We've had a big additional resource into social prescribing, and so again it's Simon's team is looking to how we can kind of link these services up and make sure that we've got an equitable offer for social prescribing across South East London. And do some investigative work really around personal health budgets. They've always been a little bit more tricky to meet because they're so dependent on funding, but he's working hard on trying to progress that in South East London. And underpinning all of personalised care really is that idea that we don't know what matters to patients till we ask them. Therefore, to develop personalised care services, co-production really is at the front and centre. So, at the moment, he's working with a co-production group in Lambeth and Southwark, which isn't impairment led. It's actually as a mix. It's got a mix of people in that group, and then across Southeast London, he's working on peer leadership and mentorship for patients and clients, so that we can start looking at how we can really feed into more of a use co-production to feed into the strategic picture for going forward. This infographic you put in I really like, because as I've just mentioned, it's that asking, involving our clients in co-production of services, but it's the light bulb screw at the bottom that often is missing when we're doing this, so that don't want to just pay lip service to this. We want to actually get that light bulb screw into the new ICS structure and actually use some of the good ideas that patients come up with to really change services. I'd let you read this in your own time, but really this is around Simon's draft vision for personalised care. And I think the thing that I just want to stress here is what we're saying is there's an awful lot going on in South East London already on personalised care outside of cancer, and we wouldn't see that as separate to cancer. And most of that is happening in primary care and in community services. So a lot of what you have access to already would be very, very relevant and helpful for our cancer patients. And I just urge you to help us shape those services as we go forward. So I'm just going to stop sharing my screen now and introduce Gay, who's going to just talk about her role as a social prescriber in Southwark.
Hi everyone, my name is Gay Palmer. I'm a social prescriber and I work for the GP Federation Improving Health Limited, and we cover the south aspects of Southwark. Within the team, there are 7 of us as social prescribers, and we are linked with our neighbourhoods within South Southwark, and that includes Camberwell, Peckham, Dulwich and Nunhead. And at the moment, we have 2 social prescribers per neighbourhood, and we are linked to all the GPs. So we have approximately 3 to 4 GP practices per social prescriber. Within Southwark, we've been going since March the 23rd, 2020. Amazingly enough, a date I will always remember. It's the day of lockdown, and that's when we actually started. So the principal role of social prescribing slightly changed. It was really dealing with the emergency needs of the residents and individuals who lived in Southwark. And this included sorting out medication prescriptions, trying to get it delivered, dealing with food parcels, getting food banks, increased social isolation of lots of the residents. Our referral process is from the age of 18 and above, with more than 2 long-term conditions, and having what we call the non-medical needs, and that can include housing, it can include evictions, rent arrears, debt, social life. There's so many different types of things that people kind of have that, again, as health professionals, we see their sickness or their illness, but behind that, there's lots of other things that can be contributing to their health and their well-being. And the idea is, as a social prescriber, we try and help them to identify what matters to them. So once we receive the referral, it may say that housing is the issue. But in my conversation, in talking to a person, they may say, actually, I'm feeling really isolated, which for them is their primary need. So we have to then look at the social isolation alongside the housing need, which has already been identified. Once we identify their needs, we then support them in accessing the services, and that could be statutory services, but also all the services that are available in the community within the voluntary care sector. We can either signpost if someone's able to kind of connect themselves, then by all means they can go ahead. But also a lot of people that we have access to and have been referred just need an extra level of help and support. Want to know what's out there, how to kind of navigate the systems, because they're all quite complex at times. For some people, they haven't got the confidence, they don't know how to kind of ask for the help, or they don't know what they can say or the right thing to say, so we support them with that. For some people, it's just out of their comfort zones and it's just overwhelming. So we take the time to work with that person to build their confidence. You know, a lot of times, a lot of the health things is we're telling people what they need to do. Here's your tablets, you need to take it 3 times a day. We give them a lot of prescribed approaches. And the idea is we're trying to empower an individual to take control of their health and well-being. We're just supporting them and guiding them on that journey. In terms of working with cancer patients, we've already started working in a pathway supporting individuals who have cancer. So my case today is a 35-year-old who's referred to me, and the issues at the time was housing. She is 5 years post-treatment, and she has had housing issues with a private landlord, and long and short, the property is not in a very good condition. And we said, fine, that's no problem. So we started talking about the housing. It's kind of getting from bad to worse. All of a sudden, one of the days I called her and she burst into a set of tears and was just like, I just don't want to be here anymore. This is just too much for me. I've had enough of my landlord. The council's not helping me. I don't want to be here anymore. Which was completely out of like, okay, this is not what I anticipated at all. And the long and short is, in further conversation, there's a history of mental health problems. And now because the housing has become too much, the difficulties trying to get access to the right people to support her has meant that her mental health is now also being affected. So initially referred her to Shelter, the national organisation that has a team in Southwark, who did the initial part of the work and accessed the council and got her in the process. However, it's now kind of hit a bit of a sticky point. So now it's a case of, right, okay, Shelter's done as much as they can. It's now come back to me to say, right, who else can we access to ensure that this lady does not ever contemplate doing anything more? So it's now accessing the mental health teams, finding out who's out there, how quickly can we get the referrals in for her, ensuring her GP is aware of her level of mental state. She doesn't want to leave the house anymore. She doesn't want to go anymore. She doesn't want to get up. She's lost all motivation. And that's, you know, at the end of the day, like I said, she came with a housing problem. And the first few sessions, she was very bright. She was bubbly, really thankful for the help, really felt that something was going to start changing. And all of a sudden, it's kind of gone to something completely different. And that's what social prescribing can be like. It can be one problem that initially appears, situations change, and then we also have to respond. I've also had another lady who was 75 and was just feeling really isolated. Unfortunately, the pandemic means that she hasn't got access to her friends anymore. She hasn't got access to the day centres that she used to go to. Her family live far, so she's becoming very isolated. I mean, she's told me all I do is sit and watch TV all day and like nothing else. And she's like, no, because she's lost the motivation, what she's used to doing, she hasn't got access anymore. She doesn't have access to a lot of the digital media that's out there. And she feels that she's too old to learn how to use technology. I kind of said to her, I'm still learning myself, so she's still got a bit of a hope. But it was really about what matters to her. And it was just, I want to speak to a human being. I want contact. I want contact with the outside world, find out what's going on. So this was a referral to one of our befriending services who, once the pandemic is over, will also start to open up their day centres. And I called her back and she was like, thank you so much. The volunteer calls are once a week. They have a good chat for 45 minutes. They read on the phone, they do various things. And she's just felt that it's made such a difference to her life. And all it was because she felt isolated. So that's the kind of aspects and impact that social prescribing can have. Our referrals can vary. It can have one problem, it can have 7 problems. But the idea is I focus on what matters to that person. Some things are very quick wins, very quick signposting. Other things will take a bit of time, but that's the difference that we have with social prescribing. The GP and other health professionals have a short period of time with an individual. My first assessments can be about 45 minutes, and I can have a whole life story given in the 45 minutes. But what it does is it helps me to help that person to keep taking the steps forward to improve their health and well-being. So that's me wrapping up what social prescribing is. And I'll hand back over to Sam, who will go on further. Thank you.
Thank you, Gay. That's a really good, two really great examples there of, how it was probably relatively minor interventions having massive impacts on people. And actually that First Lady, thinking about her, keeping her out of hospital, actually keeping her out, not needing to present at A&E, you could see that the way that one might have be going. I'm just going to ask Bav now to play a short film that our Dave Barnard is our project lead for the Macmillan Right by You programme, which is a specific programme looking at how we can implement the social prescribing offer into the cancer pathway.
My name's Dave, and I've been working on a Macmillan funded project, the Right by You programme, in South East London, promoting social prescribing to improve wellbeing for people with cancer locally. Of social prescribing, we know that people go to their GPs and health professionals presenting other factors as well as their general health condition, and these may be more of a social aspect, financial impact, employment benefits, and environmental factors such as housing, whether these factors are impacting on their health and well-being, or their health and well-being is now impacting on these factors. The aims of social prescribing is really looking at helping people to live their lives as well as possible, focusing on enabling them to help them make decisions, to support them to take control, to improve health and well-being and social welfare. How can social prescribing help? It really looks like at the link worker supporting that individual person to access their personal networks, linking to local practical support, linking to advice services, and emotional support within communities and the voluntary sector. And the impact of social prescribing. So we can see from University of Westminster reports that GP attendance are reduced by an average of 28%, A&E attendances are down on average of 24%, for those people who are engaging in social prescribing and through that linking to local services and projects that will improve their health and well-being. And thinking more around people with cancer, we can see that they have a number of significant social care needs. So 64% of the people living with cancer have practical and personal needs. 32% of them may have mobility needs. This could be where a taxi card or a blue badge application might be of use. 31% may have housework and cooking support needs. And this is where maybe a shopping service or even the Good Sam and the Good Gym volunteers might be able to help out. And with 14% of people reporting a personal care support need, the social prescribers, through the work they do together, would then be able to refer back into social services for an assessment. And 78% of people may well be having emotional needs because of their cancer. So we can think around looking at linking people to the local wellbeing services, counselling services, Mind, some of the modern apps as well that are available. Key principles of social prescribing. It's important to see that it's tailored to the individual. There's a real one-to-one relationship between the link worker and the client themselves. It looks at offering support with emotional, social and practical needs. It enables people to make changes in their own lives. And it's positive and solution focused because it's really looking at developing links to local services that are on that person's doorstep. What it isn't is it's not an alternative to social work, social care or occupational therapy. It's not an alternative to funding those sorts of essential services because the social prescribing services are a bridge to link people to these other local community-based services. And it's not new. Signposting, linking people to local communities has been going on for years. What is slightly different at the moment is that this is a new funding model that's then being rolled out nationally. So thinking a bit about those patient needs, we can see that 1 in 4 people living with cancer, so way over 500,000, face poor health and disability after treatment. 70% may need emotional support. So 2 in 5 living with cancer are affected by depression, 1 in 10 affected by anxiety. 80% of people are experiencing a financial impact because of the cancer. And this could be way over £500 a month. So linking that person to the local employment support, financial services, CABs, could help alleviate this issue. 25% of people living with cancer experience loneliness. And we know through the last year, there are so many phone-based, online-based, Zoom-based befriending services that might be able to assist people here. And 87% of people with cancer who were employed at the time of receiving their diagnosis would like to return to work. And only half of these people know where to go to get help with this. And again, this is where the social prescribers have that local knowledge of employment services, job centre pluses, that sort of thing. So what are the plans? So what we've been doing across South East London so far is engaging the local social prescribing teams, developing some training, some information resources, linking secondary care teams with social prescribing teams, so there's a bit of a mutual awareness of each other, what they do, how they do it, exploring some possible referral work pathways, so maybe for some of the different boroughs where the social prescribing teams could have third-party referrals, and then gathering that feedback of successes, challenges and gaps and feeding that back up into the South East London Cancer Alliance and Macmillan themselves. There's my name, phone number and my email if anybody wants to get in contact with us and have further discussions around how we can develop this service in this local area here. Thank you for your time.
Thank you. So that's a little bit about the Right By You project. Nicola, can I bring you in here?
So just one thing to say at the start, Dave is on a temporary leave of absence. So if you want to contact us, do feel free to contact me, because I'm the GP Associate Advisor with the South East London Social Prescribing Project, and we're working together on developing things. So I think, we've had such a brilliant description by Gay of what social prescribing is, and that Dave has given the context of cancer. What I would say is that for people with cancer, most of the things that we're talking about would not be any different to somebody with another health condition. But there are some elements that, are specific to the experience of having treatment for cancer and all that it brings with it. So as a project, what we're trying to do is build links across secondary to primary care, so that really we can mainly achieve awareness and raising awareness of what we can do for people in the community within the hospital teams. Now, in terms of the link workers who are working in South East London, we are trying to develop and offering some support for link workers to develop their confidence dealing with cancer. There's a lot of fear about bringing up the subject, talking about it. There's a lot of people feel uncomfortable often to talk about cancer, and really they needn't. And it often takes very little in the way of discussion and focus group kind of workshop type activity to really take you, I think, from a place where you're frightened about talking about it to where you really understand that it's really, something that it's easy to talk about, and really you just need to know where you can go for help. So as link workers, what we're hoping to do, Dave and I, is to set up a workshop a bit later in the year when it's possible to think about anything other than vaccinating people for COVID, to try and introduce people to a sort of a menu of resources that they could access, so that we can develop people from whatever level of skill they start at. Some people will already be confident, but some will never have dealt with somebody with cancer and just need to feel, need a little bit more support in kind of making that step. So that's kind of where we're at, really: awareness raising, coordination across cancer pathways. And we have achieved some of that already. So Gay is one of our link workers who's taken a lead in this. And we in Southwark have started a project trying to link up with the lung team and the head and neck team. I'm hoping that we will be able to work with the hospital-based navigators so that there will be more awareness in the hospitals and conversation about what's available in the community. That's really where we're at.
Thanks, Nicola. It's just really coming from a kind of secondary care background and learning more about social prescribing. It's just it's such a valuable resource that we really need to get our cancer patients better access to. So it's a really exciting project. I think what we've tried to convey there is that there's so much support out there for people that come with a cancer diagnosis, but also have then they're not just defined by their cancer, and it's important for us to consider all of their health and well-being needs. However, there is a time and place, I think, where it's appropriate to direct people to more cancer-specific health and well-being support and information. And if you're not working all the time in cancer, you don't, or even if you are actually, you don't always know where to look or how to direct people. So the second part of this presentation is now just kind of drawing your attention to some of the resources out there, so that if you have a patient that presents and you don't know where to start, hopefully this will be a bit of a resource kit of where you could direct patients for help. So you're all probably aware that we have cancer information centres at each of the 3 trusts in South East London, but I'm just not, it may be that you don't necessarily know what they're doing at the moment because of COVID, or which patients they would take or not take, but I think the overriding message is that all of them would be happy to be contacted, and if they can't help, they would redirect that inquiry to a place where they can help. So for example, if a patient who hadn't been treated at Lewisham and Greenwich but lived nearby Lewisham and Greenwich Trust contacted the MAGS service there, they would do their utmost to help them out and make sure that the patient was directed to the appropriate service if they weren't able to help. So I think pointing patients to any of these is a good start. And thinking about I've started with the more kind of human approach of these cancer information centres that usually people can just drop into. That's harder to do at the moment, but thinking about with the health inequalities agenda, wanting to make sure that people can access help if they haven't got access to more of the virtual world and the technology. At the moment, all 3 are offering a service, so they can all be contacted. The King's service you cannot drop into at the moment because their building is still closed due to the COVID restrictions. The Dimbleby service you can drop into if you're a patient that's attending treatment at Guy's and you're there for another appointment. They are open, and the MAGS service is a phone support service in usual times. They are starting to run some of the more health and wellbeing events virtually, and I'll come on to that in a minute. But I don't know whether you are aware that both King's and LGT have a fantastic cancer web pages. So both of them have spent an awful long time kind of updating these pages fairly recently, and they're a really good wealth of information, and obviously they're local to our patients, so they're a bit more maybe acceptable sometimes than some of the more national websites. So I would urge you to have a look at them as a resource for yourselves as well, because I've certainly found out all sorts of things on here that I didn't know about. So I've just put the links on there and screenshots of the sorts of things that they cover, but really from support groups that are available, rehabilitation, psychology support, different kinds of social support that's available, and then quite a few links to symptom-based issues, so around things like fatigue, lymphedema, that sort of thing. So I'd urge you to have a look at that, and it's a way of clicking through to other help as well. you may have heard, if you've been on one of these before, you may have heard me talk about the Cancer Wellbeing London website, which originally was commissioned by the Fall of Cancer Alliances to advertise face-to-face health and wellbeing events. We in Cancer have, as part of one of the long-term plan objectives, an obligation to make sure that we give access to health and wellbeing event access to patients. Obviously, at the moment, they are no longer face-to-face, but we are holding some virtually across the system. So what we've had to do is just, as we had this platform, we were just about to launch before COVID, and then COVID hit, and so we did repurpose it to include quite a lot of extra information. There's also so a lot of helpful videos and advice on there as well. So again, it's one of the ones to look out for. What we did was we took the top 10 concerns that come up on our holistic needs assessments that come up regularly, and we produce short videos for patients on each of these. So they're very common concerns that come up regardless of the tumour type. So it's a starting point for patients to learn a little bit about more symptom-based issues that they may be having. As part of COVID, we also felt that it was important to link patients through to charities that were offering additional support. So as you can see here, there's some headings: the psychosocial support, physical activity and bereavement support. And what we've got on the website is a page where people can click along to those charities and to the pages that offer particular support from those charities. So again, even if you're not giving this to patients, it's a good resource, an easy resource for you to look at to be able to direct patients to the right charity. The Cancer Care Map's another website, which you may well have heard about as well. This is an ongoing project, really, started by Dimbleby Cancer Care, the cancer charity, and it's really to map the services that are available for patients across the UK. So it's a patient-facing website, and what patients can do is to go in and put their postcode in and see what's going on around there. So a lot of I've just put the section of South East London, so there's quite a lot of blue arrows, but not nearly enough. We know there are a lot more offers of support in South East London than is there. So but it's just to give you an idea, and a lot of these are, again, not cancer specific. It's things like exercise programs, financial services, bereavement services, social groups, walking groups. There's a whole load of things on there, as well as being some of the cancer services. So at the moment, we're working with the Cancer Care Map to really promote this in South East London and get as many of the services that we can on there as this kind of single point of reference for patients with cancer to go to. There's a few more resources that you may not know about. So our patient support groups obviously can't meet face-to-face at the moment, but a lot of them are still running in via the hospitals. We've helped in the Cancer Alliance quite a lot of them move to a virtual offering so that patients can still interact with each other. So the best place to go to for information on those is either via the hospital web pages or directing the patients back to their CNSs to ask about those. St Christopher's Hospice they did it first lockdown, and they've done it again this time. They've done this fantastic wellbeing online program, which obviously, you know, people need to have access to the technology, but you don't have to be under St Christopher's for a lot of the activities. So again, it's a place that you know, to direct people to, and they don't even need to be necessarily living near St Christopher's now, because it's all delivered virtually. Within South East London Cancer Alliance, we now do have a Twitter account. The first lockdown, we didn't have anything, so it was quite difficult to be able to help reach patients. So this is a growing account, but what we're trying to do is send, just as a little tiny way to help people access support, is send out a weekly wellbeing tweet. So if you followed us, you would at least be getting that and hearing what was going on as well, if you're Twitter inclined. And there are a couple of things that we've got in development in South East London as well. So we're developing a South East London wide personalised cancer care leaflet for patients, which has some signposting on it, which is just going through all of it's just going through all the checks. And we are hoping to have the SELCA website up and running sometime in April, which we haven't had before. Apps, we need to just mention apps, because I'm going out of my comfort zone now into something a little bit more digital that's slightly beyond me, but certainly for a group of our patients, apps are a really good way of supporting their health and well-being. The NHS app library is growing all the time, and they go through quite a rigorous process to get on that library. So the two at the moment that I would draw your attention to that have been verified are the breast cancer support app and the Beating Cancer Fatigue app, which are both very good and free. There are loads of cancer health and wellbeing apps being developed at the moment, and we are, as an alliance, trying to look at work with the Health Innovation Network to look at these in a bit more detail and see if we can pilot some of these. And then on the cancer care map, there are some further cancer apps as well, which haven't been through the NHS verification system, but I don't necessarily think that means that they're rubbish. I think, you know, there's still ones that may benefit patients. So just so that you're aware. I haven't mentioned Macmillan, but of course Macmillan has got a whole host of things. So there's a link to the websites there. Just to point out that if you're doing a cancer care review and using the template on your HWBIS or GP system, there are quite a lot of links to patient information on there from Macmillan. So that's another easy way of kind of accessing and printing off things for patients. Talking about some of that kind of social isolation, Macmillan have several ways that people can speak to other people that are going through the same thing. Particularly the telephone buddies are all volunteers that have had cancer themselves. They all have special training, and sometimes people just want to talk to somebody who understands what they're going through because they've gone through it themselves. So it's a really important service and one that's really valued by our patients. And Macmillan are still giving out grants for needs that need to be met, and have a whole host of GP resources as well, which I think you might have, be aware of already, but just as a little reminder. So I think just before I move on, then I think it's just fair to say that I feel sometimes that there's an overwhelming amount of support there, and that can feel very overwhelming. But hopefully, if you've got these slides, you've got a little catalogue of things that you can tap patients into. And definitely the first port of call would be social prescribing, I think, because they're local to yourself and the patients. And I do think it's important that patients' needs are met in their locality whenever possible. So finally, how I wanted to just draw your attention to the fact that the National Cancer Quality of Life Survey is just in the process of being rolled out. It was launched in December to breast, colorectal and prostate cancer patients. And I feel that this is a real opportunity to judge whether we are meeting the needs of people with cancer's health and well-being needs. This is a national programme. There was a 3-year pilot before it was launched. It is a population-based survey, so for some of especially our cancer clinicians, that feels a bit unsatisfactory because they're not getting information directly about their patient. But I think in terms of what we're doing in South East London, it's going to be very helpful to be able to understand where we need to improve our services. So as I said, it rolled out to 3 tumour groups in December, and throughout this year it will roll out to in a staged approach to the other tumour sites. We're yet to know in what order. all patients that I think it's being administered by Public Health England, so it links into the cancer registry data that they get, and patients that are eligible, you know, that haven't moved onto palliative or end of life care, will be sent an invite to complete a quality of life survey 18 months post diagnosis. So this is going on all the time. It's very different to the National Patient Experience Survey, which is a snapshot once a year, and all patients that are eligible would be offered a chance to fill in the survey. They will offer it as an electronic link and a paper version, so patients would be written to. And just on the, we've been really challenged in South East London. We've not been able to put out any comms about it really yet, because it hit as soon as COVID hit, and we had a bit of a moratorium on comms that weren't to do with COVID. But in spite of that, we still got a 23% response rate, which I don't know, I'm ever the optimist, but I thought that was very good, for saying that patients were getting this absolutely cold. However, it is one of the lower in the country, but the ones where the response rate is higher is where they've done a lot of comms prior to COVID. But I think obviously we need enough people in the different tumour groups to respond to get proper data. And the reason I'm kind of bringing it up is because patients might come in and ask you about it, or they might you know, bring that I'll show you in a minute, their patient report to you, or it might flag a need that they come to you. So I think, you know, if you can promote it, mention it to patients. If you're doing a cancer care review, say it's coming. That would be just really helpful. These are the quality of life metrics that would be looked at in that questionnaire. And the reporting we will get at different levels. So we will get South East London data. We can then define that down to tumour type or to borough. So we can really look at, you know, where we might need to target working with our support services in a certain tumour site or a certain borough. And then patients themselves, this is still just being rolled out now, we'll get a kind of a summary, which I'll show you is like this, where it just gives them a kind of visual idea of where they are compared to other people. This has taken quite a bit of development by the national team. It's had a lot of patient involvement into how it looks and what its purpose is. But again, it might be something that they turn up in the practice with. So I wanted to include it here so that you know what that's all about. And that really is all that I had to share with you. I've just put my contact details, but we can make sure that you've got Gay's and Nicola's as well. If there are any, I don't think there are any questions in the Q&A that I can see. Is there anything that anybody wanted to ask while we were on? Or Nicola or Gay, anything that you wanted to add?
I think you've given a really good overview of what's out there. So I don't have anything extra.
That's good. And I'm certainly not going to keep people on the call if there are no questions. I just would hate to think that someone was typing and then I end the call. So I'll just leave it one more.
Something we're planning to do as a next development, hopefully, is to, with the help of Guy's and St Thomas's and the alliances, to produce a short video, just kind of summarising the best parts of what's really been talked about in this meeting, particularly focused around social prescribing. As a little film has been created for breast cancer screening. It's short and it's really easy to kind of really get a feel for what's going on in breast cancer screening. So my hope was that when we have got that film ready, we would be in general practice able to easily share it using an AccuRx link. If we wanting to kind of communicate to people what social prescribing is and what it might be able to offer, which would hopefully aid communication when, particularly if you're somebody who hasn't had much contact with social prescribing in the past, and you might find yourself struggling to describe it. So this should be hopefully an off-the-shelf, easy tool to use. coming soon, hopefully.
Thanks, Nicola. Anything else from you, Gay?
Oh no, I'm done. It's all done.
Okay, all right, well, thank you everybody for your time over this lunchtime. I hope it's there have been some aspects of interest that you can take away. As I said, when the call closes, you will get sent a link to the evaluation, which we would really be keen to get from you, and then once you've completed that, you'll get your certificate of attendance. So without further ado, I'll just say goodbye, and thank you again. Have a good week.